Ever wondered what happens during those magical 9 months of pregnancy? It's a journey of joy, anticipation, and change. Understanding the philosophy of pregnancy is essential. It's not just about growing a baby, but also about the transformation of you as a woman. Yes, it can be daunting with the myriad of changes your body goes through and the challenges that accompany this life-altering event, but with knowledge, these can be navigated with grace. Stay tuned as we delve deeper into the facts surrounding pregnancy that you should be aware of. How does exercise fit into your pregnancy, and why do those peculiar food cravings occur? Let's start with exercise. It plays a vital role in maintaining both your physical and mental health during pregnancy. Regular, low-impact activities like swimming or walking can help you manage your weight, improve circulation, boost mood, and even make labor and recovery smoother. Now, onto those curious food cravings. They're a common part of the pregnancy experience, often attributed to hormonal changes that impact your sense of taste and smell. You might find yourself desiring foods you've never liked before or needing to eat certain foods at odd hours. It's okay to indulge sometimes, but remember, healthy eating habits are crucial for your well-being and that of your growing baby. As we see, staying active and understanding your body's changing nutritional needs are key during pregnancy. But what if the pregnancy was unexpected or tragically didn't go as planned? This question takes us into the realm of unplanned pregnancies. A surprise pregnancy can be a roller coaster of emotions. You might feel excited, scared, overwhelmed, or all of these at once. It's perfectly normal. The key is to take a deep breath, gather your thoughts, and make an informed decision. Consult with healthcare professionals, reach out to support groups, or confide in trusted loved ones. Now let's talk about the heart-wrenching experience of a failed pregnancy. The pain is real and profound, but remember, it's not your fault. Grief is a process, and it's okay to give yourself time to heal. Seek professional help if you need it. Counseling or support groups can provide solace and guidance. Remember, every pregnancy journey is unique, and it's okay to seek help when things get tough. Your strength is admirable, and you are never alone in this journey. So how can you ensure a healthy pregnancy and return to your pre-pregnancy weight afterward? Well, maintaining a healthy pregnancy involves a balance of good nutrition, regular exercise, and staying in tune with your mental well-being. Eating a well-balanced diet rich in fruits, vegetables, lean proteins, and whole grains is vital. Regular checkups with your healthcare provider are also critical to monitor your health and that of your growing baby. After welcoming your little one into the world, it's natural to want to get back to your pre-pregnancy weight. But remember, patience is key. Your body has accomplished an incredible feat, and it needs time to recover. Introduce gentle exercises as advised by your healthcare provider and continue with a balanced diet. Breastfeeding can also help with postpartum weight loss, but every woman's experience is unique. Above all, remember that your health, both physical and mental, is paramount. From the start of pregnancy to the postpartum stage, awareness and care can make all the difference. Lastly, let's talk about those early whispers of pregnancy. What are the signs? Well, it starts with a missed period, but there are other subtle hints too, like tender breasts, slight bleeding, fatigue, and an odd aversion or craving for certain foods. Nausea, commonly known as morning sickness, might also make an appearance. Frequent urination and mood swings are also in the cards. Remember, these signs may vary from person to person. Knowing the early signs of pregnancy can help you prepare for the exciting journey ahead.
Pregnancy is a time of immense change. Your body transforms to nurture a growing life. Exercise during this period needs a special touch. One size doesn't fit all. Think of it like choosing a maternity dress. You wouldn't pick one that's too tight or too loose. Similarly, your exercise routine should be just right for you. It should consider your fitness level, pregnancy stage, and any medical conditions. Just as a tailor adjusts a dress for the perfect fit, your healthcare provider can help tailor an exercise plan. This plan will adapt as your pregnancy progresses, ensuring your safety and well-being. Remember, staying active during pregnancy is about nurturing both you and your baby. Exercise offers a wealth of benefits during pregnancy. It's not just about physical health, it impacts your mental and emotional well-being too. Regular physical activity helps manage weight gain, a common concern for expectant mothers. Think of exercise as a gentle nudge to your metabolism. It keeps things running smoothly like a well-oiled machine. Exercise also improves circulation, delivering essential nutrients to your baby. Staying active can alleviate common pregnancy discomforts like back pain and fatigue. Exercise also promotes better sleep, a precious commodity during pregnancy. It's like investing in a good night's rest, allowing you to wake up refreshed and energized. Selecting the right exercises is crucial during pregnancy. Walking is a great option, accessible and gentle on your joints. It's like taking a leisurely stroll through the park, enjoying the fresh air and sunshine. Swimming provides a full-body workout with minimal stress on your joints. Prenatal yoga combines gentle stretches and controlled breathing, promoting flexibility and relaxation. It's like a calming meditation, easing your mind and body. Low-impact aerobics, tailored for pregnancy, gets your heart pumping without putting excessive strain on your body. Strength training, using light weights or resistance bands, helps maintain muscle tone and strength. Remember, each exercise should be performed with proper form and within your comfort zone. Section 4. Intensity and safety. Intensity is key when exercising during pregnancy. It's crucial to listen to your body and avoid pushing yourself too hard. Think of your energy levels as a fuel gauge. You definitely don't want it to dip into the red zone. Stay hydrated by sipping water throughout your workout. It's like replenishing your body's fluids, keeping you cool and energized. Avoid exercises that involve lying flat on your back, especially after the first trimester. This position can restrict blood flow to the uterus. If you experience any discomfort, dizziness, or unusual symptoms, stop exercising immediately and consult your healthcare provider. Remember, safety should always be your top priority. Section 5. The importance of professional guidance. Before embarking on any exercise program during pregnancy, consult your healthcare provider. They are your trusted guide, ensuring your journey is safe and beneficial. Think of them as your personal trainer, equipped with expert knowledge about your specific needs. They can assess your health, consider any potential risks, and recommend appropriate exercises and intensity levels. Regular checkups allow your healthcare provider to monitor your progress and make adjustments to your exercise routine as needed. This ongoing support ensures that you are exercising safely and effectively throughout your pregnancy. Remember, prioritizing your health and well-being is the greatest gift you can give yourself and your baby.
Pregnancy is a wild ride. It's full of surprises, especially when it comes to food. Suddenly, you're mixing pickles and ice cream, craving spicy food at 3 a.m., or wanting to eat things you never liked before. These quirky cravings are a hallmark of pregnancy. They're often the source of amusement, confusion, and sometimes even a little bit of shame. The most common pregnancy cravings revolve around sweet, salty, and sour flavors. Chocolate, potato chips, and pickles are often top contenders. But pregnancy cravings can go beyond the ordinary. Some women find themselves wanting strange combinations, like peanut butter and pickle sandwiches. Others develop a sudden fondness for foods they previously disliked. These strange desires can be baffling, but they're usually harmless and temporary. Indulging in these cravings within reason can be part of the fun of pregnancy. However, it's essential to distinguish between typical cravings and unusual ones. While craving chocolate is normal, longing for dirt or chalk is not and requires medical attention. Pregnancy is a journey of discovery, and food cravings are part of the adventure. Understanding why they happen and how to manage them can make this journey smoother and more enjoyable. So let's dive into the science and myths surrounding these quirky food desires. Why do these cravings hit, you ask? The answer lies in a complex interplay of hormones and psychology. Pregnancy brings a hormonal roller coaster. These hormonal shifts can influence taste and smell, triggering cravings for specific flavors and textures. For instance, the surge in progesterone can heighten your sense of smell. This can make certain foods more appealing. Meanwhile, estrogen fluctuations can lead to cravings for comfort foods, providing emotional solace during this period of change. But hormones are only part of the story. Pregnancy also comes with psychological changes. Food cravings can be a way of coping with stress, anxiety, or fatigue. They can also be linked to nutritional needs. For example, craving red meat might indicate an iron deficiency. It's important to listen to your body and pay attention to your cravings. While many cravings are harmless, some might signal underlying nutritional needs. Discussing your cravings with your doctor can help ensure you're getting the necessary nutrients for a healthy pregnancy. Understanding the interplay of hormones and psychology can empower you to make informed choices about your diet. It's about finding a balance between indulging in cravings and nourishing your body and your baby. One of the most persistent myths surrounding pregnancy cravings is their supposed ability to predict the baby's sex. Craving sweets? Must be a girl. Longing for salty snacks? It's a boy. These beliefs are passed down through generations, adding a fun layer of mystery to pregnancy. However, there's no scientific evidence to support these claims. Cravings are driven by hormonal and psychological factors, not the baby's gender. These myths are mostly harmless, providing a source of amusement and conversation among friends and family. It's important to remember that these are just myths. Don't base any major decisions on these beliefs. The only reliable way to know your baby's sex is through medical tests like ultrasounds. So enjoy the guessing game, but take it with a grain of salt. Ultimately, whether you're having a boy or a girl, the most important thing is a healthy pregnancy and a happy baby. While most cravings are harmless, some can indicate underlying health issues. Cravings for non-food items, known as pica, can signal nutritional deficiencies. For example, craving ice might indicate an iron deficiency, while craving dirt might point to a zinc deficiency. These unusual cravings require medical attention. Ignoring them can lead to health complications for both you and your baby. Your doctor can assess your nutritional status and recommend appropriate supplements or dietary changes. It's also crucial to be mindful of the quantity and quality of the foods you crave. While indulging occasionally is fine, excessive consumption of unhealthy foods can lead to weight gain, gestational diabetes, and other pregnancy complications. Remember, moderation is key. Balancing your cravings with a nutritious diet is essential for a healthy pregnancy. If you're ever unsure about a craving, don't hesitate to reach out to your healthcare provider. Navigating pregnancy cravings can be tricky. It's about finding a balance between indulging and nourishing your body. Here are some tips to help you manage your cravings healthily. 1. Listen to your body. Pay attention to what you're craving. It might indicate a specific nutrient your body needs. 2. Choose healthy alternatives. If you're craving something sweet, opt for fruits instead of candy. For salty cravings, try nuts or seeds instead of potato chips. 3. Don't deprive yourself. Allow yourself occasional indulgences in moderation. Depriving yourself completely can lead to binge eating later on. 4. Stay hydrated. Drinking plenty of water can help curb cravings and keep you feeling full. 5. Talk to your doctor. If you're experiencing unusual cravings or have concerns about your diet, consult your doctor. Remember, pregnancy is a time to nourish your body and your growing baby. By making informed choices and seeking professional guidance when needed, you can satisfy your cravings while ensuring a healthy pregnancy journey. Enjoy the ride, indulge wisely, and embrace the unique experience of pregnancy cravings.
An unplanned pregnancy can feel overwhelming. It's important to remember you're not alone. Many couples face this situation. It's a journey, and with the right approach, it can be managed. Take a deep breath, and remember this is a new beginning. Give yourself time to process the news. There's no need to rush any decisions. Understanding your feelings is the first step. Allow yourself to feel a mix of emotions. It's normal to feel joy, fear, anxiety, and even denial. Reach out to your partner for support. Talk about your feelings openly and honestly. Communication is crucial during this time. Remember, you are a team, and you can face this together. Lean on each other for strength and understanding. This is a life-changing event, and it's okay to feel overwhelmed. Taking it one step at a time is key. Focus on the present moment and the next step forward. Remember that you have resources available and people who care about you. Discovering an unplanned pregnancy can trigger a whirlwind of emotions. From shock to disbelief, a range of feelings is entirely natural. Acknowledge these emotions without judgment. It's okay to feel happy, scared, confused, or even angry. Once you've processed the initial shock, take some practical steps. A home pregnancy test can confirm the result. Schedule an appointment with your doctor or healthcare provider. They can confirm the pregnancy and discuss your options. Early prenatal care is essential for both your health and the baby's well-being. Your doctor will guide you through necessary tests and screenings. They will also provide advice on nutrition, exercise, and lifestyle adjustments. Remember, this is your journey, and you have the right to make choices that feel right for you. Gather information, consider your options, and make decisions based on what's best for your individual circumstances. Facing an unplanned pregnancy can be less daunting with a strong support system. Turn to your partner, family, and close friends for emotional support. Sharing your feelings and concerns can ease anxiety. Loved ones can offer encouragement, practical help, and a listening ear. Beyond your personal circle, consider seeking support from professional groups. Pregnancy resource centers, therapists, and support groups can provide valuable guidance. They offer a safe space to share experiences, learn coping strategies, and connect with others facing similar situations. Be prepared for mixed reactions from those around you. Not everyone will respond with the support and understanding you might hope for. It's important to set boundaries and prioritize your well-being. Surround yourself with positivity and distance yourself from negativity. Maintain a positive outlook throughout the journey. Focus on the aspects of the situation that bring you joy and hope. Embrace the changes that come with pregnancy, both emotional and physical. Remember that you are strong, capable, and embarking on a unique and rewarding experience. An unplanned pregnancy can be a catalyst for personal growth and transformation. It's an opportunity to reevaluate priorities and embrace new possibilities. View this experience as a chance to create a new chapter in your life, filled with love, strength, and resilience. Focus on the positive aspects of pregnancy, the anticipation of a new life, the bond you'll develop with your child, and the joy of parenthood are all powerful motivators. Embrace the journey, celebrating milestones and finding beauty in the everyday moments. Remember that you are not defined by this one event. You are a complex individual with dreams, aspirations, and a bright future ahead. Pregnancy can be a time of self-discovery and empowerment. Embrace the challenges and celebrate the triumphs as you navigate this unique experience. Your journey may not have gone as planned, but it can still be a fulfilling and meaningful one. With a positive mindset, a supportive network, and a commitment to self-care, you can navigate this unexpected path with grace and resilience.
Childbirth is a momentous occasion, whether it's a firstborn or the seventh. The health and upbringing of a newborn is heavily influenced by how well a mother prepares for this delicate journey. While reading books and watching videos can be helpful, nothing compares to first-hand experience. Let's dive into understanding a crucial part of female anatomy: ovulation. Ovulation is a phase of the menstrual cycle where an egg, or ovum, is released from the ovaries. If this ovum meets sperm during its journey down the fallopian tube, conception occurs. This process might sound straightforward, but it actually depends on a complex interplay of glands and hormones. Why do some women struggle with conceiving? Often it's linked to the hypothalamus, a gland using hormones to communicate with the pituitary gland, which we refer to as the master gland of the endocrine system. The pituitary gland then produces luteinizing hormone, or LH, and FSH. Elevated levels of LH typically trigger ovulation within 2 days. Here's what happens during the cycle. Mature follicles release an ovum into the peritoneal cavity, then into the fallopian tube, and from there it travels to the uterus. If the ovum doesn't encounter sperm within 24 hours, it dies. Ovulation occurs about 2 weeks before the onset of a menstrual period and happens once every month until menopause, barring any breaks for childbirth and pregnancy. During this time, you might notice changes in the cervical mucus, which becomes slippery and slick, often accompanied by general or localized pain. Sometimes the menstrual cycle might vary from 24 to 35 days, or you might experience slight fever, especially if you're following natural family planning methods. These changes can lead some to confuse ovulation with premenstrual symptoms, particularly if there's pain and bodily changes. Instead of playing guessing games, it's best to confirm ovulation using kits available in the market through blood tests or a pregnancy ultrasound. Once confirmed, it's advisable to take precautions to avoid miscarriage or bleeding. Remember, motherhood is a natural and joyous part of life, and it's important to embrace it in all its phases. By understanding the signs and processes of ovulation, you can better prepare for conception and the incredible journey of pregnancy that follows.
Coping with loss, particularly miscarriage, is a deeply painful experience. It can be emotionally and physically draining. Many women feel a profound sense of loss and grief, accompanied by confusion and guilt. It's crucial to understand that miscarriage is not your fault. It's a common occurrence affecting many. During this tough period, you may need time to grieve and heal. Speak to your partner, family, or friends for support. Consulting a therapist or joining a support group can also provide guidance. Remember to take care of yourself physically. Eat healthy foods, get enough sleep, and exercise gently. Be patient with yourself as you navigate this difficult time. Allow yourself to feel your emotions fully. Don't try to bottle them up. Talking about your experience can be very helpful. It can prevent you from feeling isolated and alone. Remember, you are not alone in this journey. Many women experience miscarriage. Reach out to others who understand what you're going through. Their support can provide comfort and strength during this challenging time. Understanding miscarriage is crucial for healing. Miscarriage is the loss of a pregnancy before 20 weeks and happens in about 10 to 20% of known pregnancies. Most miscarriages occur in the first trimester, before 12 weeks. There are many reasons why miscarriages happen, and sometimes the cause is unknown. However, some common factors that contribute to miscarriage include chromosomal abnormalities, hormonal problems, and maternal health issues. Chromosomal abnormalities are a leading cause of miscarriage, with genetic problems within the developing baby occurring by chance and not caused by anything the parents did or did not do. Hormonal imbalances can also lead to miscarriage, with conditions like PCOS or thyroid disease affecting pregnancy. Maternal health issues like diabetes, autoimmune disorders, and infections can also increase the risk of miscarriage. It's important to discuss any health concerns with your doctor before and during pregnancy. Chromosomal abnormalities are a significant factor in miscarriages. Chromosomes carry genetic information, and errors in these chromosomes can prevent a baby from developing properly. These abnormalities are usually random events and are not inherited from the parents. The most common type is called trisomy, which happens when there is an extra chromosome. Another type is monosomy, which means a chromosome is missing. Chromosomal abnormalities often result in the pregnancy ending naturally, as the body recognizes that the baby cannot develop normally. This can be a difficult concept to understand, but it's important to remember that these abnormalities are not anyone's fault. They are simply a part of nature's process. Recurrent miscarriage is defined as having 2 or more consecutive miscarriages. It affects about 1% of couples trying to conceive. This can be a very emotionally challenging experience. If you experience recurrent miscarriages, it is important to seek medical advice. Your doctor can perform tests to identify potential causes. These tests may include genetic screening, hormonal evaluations, and uterine examinations. Treatment for recurrent miscarriages depends on the underlying cause. In some cases, lifestyle changes like a healthy diet and exercise can help. Other treatments may include hormonal therapy or surgery to correct uterine abnormalities. Even with recurrent miscarriages, hope remains. Many couples go on to have healthy pregnancies after experiencing multiple losses. The journey after a miscarriage is a personal one. Every woman experiences it differently. Remember to be kind to yourself. Allow yourself time to grieve and heal. Seek support from loved ones. Share your feelings with your partner, family and friends. Consider joining a support group to connect with others who understand your experience. Professional counseling can also provide guidance and coping strategies. While miscarriage can be a heartbreaking experience, it does not have to define your journey to parenthood. Many women who experience miscarriage go on to have healthy pregnancies in the future. Focus on your physical and emotional recovery. With time and support, you can navigate this challenging time and look towards the future with hope.
Congratulations, you're pregnant. Now let's get down to business. According to the National Women's Health Resource Center, everything you do in the next 9 months, from what you eat, to what you drink, to how physically active you are, and even your weight, has the potential to affect your child's current and future growth. A new report explores the growing body of research that finds conditions in utero, that is, while you're pregnant, have the potential to affect your child's health even decades down the road. For instance, did you know that women who drink during pregnancy could increase their child's risk of alcohol addiction later in life, even with just one drinking binge? Other studies suggest a significant correlation between a mother's nutrition during pregnancy and her child's risk for being overweight, developing diabetes, and heart disease later in life. The message here is simple. Eat right today and prevent future health problems for your child. When we talk about eating right during pregnancy, we're looking at two components. One is the type of food you're eating, and the other is how much weight you gain. For many women, pregnancy is the first time in their lives when gaining weight is a good thing. But don't go overboard. You do not need to consume any more calories than your normal daily intake during your first trimester. After the first 12 weeks, you may consume up to 300 extra calories per day. If you are of normal weight when you get pregnant, you should aim to gain between 25 and 35 pounds. Try to limit weight gain to no more than 5 to 10 pounds in the first 20 weeks and about a pound per week for the remainder of your pregnancy. Doctors strongly suggest, however, that if you are overweight, try and lose some weight before you get pregnant. Being overweight can increase your risk of emergency cesarean, gestational diabetes, high blood pressure, and miscarriage. There is also a greater risk of delivery complications. Your healthcare professional will help you determine where you fall on the weight scale during your first prenatal visit. As always, talk to your healthcare professional about any special dietary concerns, especially if you're vegetarian or vegan, for example. Remember, taking care of your health is not just about today. It's also about securing a healthier future for your little one. Stay healthy, stay informed, and enjoy this beautiful journey.